Greetings from the World Health Organization, and thank you so much for inviting me to speak at the India TB Summit 2022 with a topic that resonates a lot. It's called India Ending TB Together, the Need for Equitable Approaches. I think we're all familiar with the current statistics around the TB pandemic. Last year, we had 10 million people developing TB in 2020, but only 5.8 million were diagnosed and reported. And this is an 18% decrease from 2019. And this was particularly concentrated in 16 countries, including some of the large Asian countries like India, Indonesia, Philippines, as well as China, which are the countries which which also had major COVID outbreaks and healthcare service disruptions. TB deaths have also increased, probably because of reduced access to healthcare. And we know that in 2020, there were roughly 1.5 million TB deaths reported worldwide. And this is very notable because it's the first time that we've seen a year-on-year increase in TB deaths since 2005. We've also had other negative impacts, like a 15% reduction in the number of people treated for drug-resistant TB, a 21% reduction in people getting preventive therapy treatment, as well as an overall reduction in TB spending globally from 5.8 billion to 5.3 billion. And therefore, it's of great concern that we're going to be off track for the SDG targets, and certainly in India for the very ambitious 2025 elimination targets. If you look at specifically the data from India, apart from the reductions in case notification, we also find that looking at the treatment success rates, of course, this predates the pandemic. So we have data from 2019 cohort. We had a success rate of 84% for new and relapsed cases, but only 56% for MDR-TB cases and only 48% for XDR-TB cases started on treatment. And for HIV-TB as well, this was around 71%. Now, we know that there are a large number of MDR and XDR-TB cases that are probably missed. And even of those starting treatment, only about half are having a successful outcome. So this is, again, of concern because clearly it means that we are not managing MDR and XDR TB that well. The other thing which is worrying, of course, is that we know that the pandemic has pushed at least 100 million more people into poverty, and that we know the links between poverty, undernutrition, and TB are particularly marked. And in India, it's estimated that about 50% of the risk factor for TB is actually attributable to undernutrition. Globally, this is about 20%. So we also are aware of the gaps in terms of regard to prevention, diagnosis, and treatment. And these are important because they are informing us about the research needs. So, for example, for preventive therapy, clearly we need more specific sensitive tests for TB infection. We need better biomarkers that tell us about the progression, the risk of progression of disease from infection to active disease. And we need better treatment options for the contacts of people with both drug sensitive as well as drug resistant TB. So big gaps, and there's a lot of scope for research, for example, including new vaccines that could be used amongst household contacts for prevention of TB and also simpler drug regimens. And of course, we are facing big gaps in using the existing tools we have, and we need to scale those up. Systematic screening, I think the bidirectional screening that started with HIV and diabetes and then has been extended to COVID, I think that's a very good approach really to the detection and management of respiratory diseases as a whole. And so I think if we can think of an integrated approach when somebody presents with a cough, then what sort of algorithm does one use and how does one actually solve the problem of the person or the patient? Because clearly the approach the TB program uses is to find out TB cases, but actually what the person and the patient is interested in is a treatment for his or her symptoms and underlying illness. So again, bringing together NCD screening like hypertension and diabetes, along with TB, COVID, or other respiratory infections, because we know that early diagnosis and treatment is important for all of these conditions. How do we maximize the use of our health workers and our community health workers? And also keeping, again, the person at the center of it. The person has one body, would like to have all of their health issues addressed at one point of contact and not having to run around. As it is, we have so many people with undiagnosed and undetected hypertension and diabetes. So again, these are important opportunities for integration of services at the primary healthcare level and below. In terms of detection, we know that not everybody is getting access to a molecular test for TB and a molecular test for drug resistance. This is important. We have indigenous technologies like TrueNat now that are WHO approved. And so I think also more research is needed on point of care tests using saliva and other specimens as for easier testing for TB, just like we were able to do for COVID. Now we have rapid tests which can do at home and self-diagnose COVID. So of course, we're still far away from that, but we know that globally a rapid molecular test was used as an initial test in only 33% of 5.8 million people who were diagnosed with TB in 2020. And again, on the treatment side, we still need to continue to do clinical trials, innovative designs to try and shorten treatment regimens, to try to have better acceptable regimens which are safe, which don't cause side effects, and which are easier to take. Again, keeping the patient in mind. The tolerability is really important, including for pediatric age groups. We have learned a lot of lessons from COVID, and the one lesson that we've learned, I think, is firstly that science can find the solutions, that we have so much of advance today in science and technology that we will be able to find a solution. We just need to work in a mission mode, and we need to come together and have a common objective, and then be willing to share data, share knowledge, share information, of course, put funding and resources into doing the clinical trials and the operational research that's needed. And high burden countries like India can really take the lead in this space. The second lesson, which is a sad lesson that we've learned, is around the equity, that even if you are able to develop COVID vaccines and therapeutics, we have not been able to provide access still to billions of people around the world. And I think TB patients are some of the most marginalized, belong to the really vulnerable and high risk and marginalized groups in every country. They're the poor, basically, and the people who have least access to services. And so it is our responsibility to ensure that whatever advances in TB are made, that the first people who should benefit are those who are usually at the back of the queue and who have, the least amounts of not only money, but also health literacy. And therefore, we need to keep equity at the heart of everything we do for TB, involve the patients, involve the communities. We have a vibrant NGO sector that is working and that has grown from strength to strength. And again, because we're speaking around Women's Day, I would like to say that the contribution of women, particularly the frontline workers, to the whole of TB control really needs to be celebrated. And whether they are ASHA workers or Anganwadi workers or our BHNs, nurses, doctors, I would like to salute all of the frontline workers as well as the community volunteers and others who've been supporting the fight against TB. So I hope that this summit will re-energize us, will bring us together with, again, a renewed determination to win this battle against this very age-old enemy that we have. We've won trying to win the battle against a new virus, and we need to put the same energy into fighting tuberculosis. Thank you very much.
Namaste, good morning. It's a pleasure and honor for me to be a part of this wonderful get-together and summit that all of you have put together for TB and gender issues, both very close to my heart. TB is something we saw when we were children. And fortunately, whichever government is in power doesn't really matter. But there are some programs which we have no political differences on, and TB being one of them. And subsequent governments have worked together and worked very hard to eradicate TB from our country. But still there are several numbers which still do exist. I'll give an example of polio. Polio was something I do remember as a child. In school you would see 1 or 2 children with polio. Now fortunately we have won the war against polio. Now we have to win the war against TB, tuberculosis. And I do see in several situations that gender sometimes does become an issue with patients who are tuberculosis. And it's seen because I work on gender issues. There was a time when I was growing up, we were not talking about the LGBTQI community. But times have changed, we have evolved as a society, and I'm happy to see there are so many people are actually talking about these issues very openly. So I congratulate the entire team who has put this entire summit together, which talks about TB and gender. And it becomes slightly complicated here medically for the reason that there are some people from a certain community, it doesn't matter which one it is, but there are HIV cases and TB cases. So now people who probably have HIV are far more vulnerable to TB. So it becomes a little more complicated scientifically. So we need to work harder. We have to be very, very sensitive towards TB patients, and even more to people who have emotional issues also with gender issues. For last 2.5 years under the leadership of Shri Uddhav Thackeray, Shri Ajit Pawar and Balasaheb Thorat, we have managed in Maharashtra in the Mahavikas Aghadi government to put a group together, Mr. Dhananjay Munde, who happens to be the minister of that department, for an entire community and a full community of this entire community together for the LGBTQI community. And we want to understand their issues and we want to address them. So this committee is not just about flagging issues, but it's flagging, tracking them and resolving them. And we have got people from all these communities together on this committee, and we will be discussing TB also. I'm so glad and grateful that you all have brought this to our notice. Mahavikas Aghadi government in Maharashtra is totally committed to working with your entire team to eradicating TB from our lives. Besides that, any issues you want me to raise in Parliament, I'd be happy to. I'm an elected representative from Baramati, which I'm very grateful and proud of. But beyond that, I do speak the voice of Maharashtra and India in Parliament. So if there's anything more I can do for the community or for anything or any fight against tuberculosis, I'll be more than happy to assist you all, support you all. So let's raise our voice, and we are going to win this war. We fought the COVID war and we are on the verge of winning that war. There are no differences here. It's the virus versus us. The way it was polio versus us. This time it's TB versus us. And I'm very, very sure with all these wonderful interventions during this summit, together we will come with a roadmap and we will fight the gender issues and we will fight this war against tuberculosis. Thank you so much from the bottom of my heart to each one of you who thought of inviting me today and making me a part of this very important program, which probably will be a turning point of a new and a beautiful beginning. Good luck and best wishes to your program. Thank you.